Now, the Ministry of Health, in collaboration with the regional health authorities, will embark on a weekend of planned prostate screening for men, scheduled to take place on July 8th and 9th, actually coming up this weekend. Now, the aim of this activity is to increase educational awareness about prostate cancer and encourage positive action in men towards their health. The theme for this initiative is called "It's All About Him," a health initiative for men. And so joining us this morning to talk more about it are the Minister of Health, Mr. Terence Singh, and consultant urologist, Dr. Lal Sao. Good morning, gentlemen. Thank you so much for joining us on Now.
Good morning, Kimberly.
Minister, I'm coming to you first because it's all about him, a health initiative for men. Tell us the reason that the ministry would have embarked on such a project.
Yeah, thanks, and good morning to all. And good morning to Dr. Sao, and thank you for lending your expertise to this venture. So, Kimberly, the occurrence and the prevalence of non-communicable diseases in Trinidad is something that we have to tackle. When the population thinks about NCDs, they tend to focus more on hypertension and diabetes. But you may recall we had a whole week of screening for women for International Women's Day. Now it's the men's turn to get screened for prostate cancer and to be informed about prostate health and the importance of prostate health. To that end, we are launching a weekend of activities this weekend. All the details on our website, where we are encouraging men, especially those over 40. There it is. So you have all the times and places of what 5 RHAs. So it's Trinidad and Tobago. We are asking people, especially men over 40, to come and understand and learn about your prostate health and to get screened for prostate cancer. Prostate cancer, as Dr. Sao will tell you, is one of the leading causes of death due to cancer amongst men. And we have a very aggressive form of prostate cancer in Trinidad and Tobago and the Caribbean. Last year, we would have screened 12,932 men. And we want to continue that this morning and this weekend. For the year so far, we have screened 5,690. So this weekend is an opportunity for men to come in, get screened, get information, and take charge of your health, especially your prostate health.
Now, Minister, you said for the year thus far, you've screened over 5,000 men. Are there any cases of men actually being diagnosed with prostate cancer at this time? Do we have any numbers or figures in terms of cases?
Yeah, I don't have those figures with me, but what tends to happen in Trinidad and Tobago with all cancers, because people don't screen as early as they should, whether it's cervical, breast, prostate, they tend to know their status when the cancer is far advanced, stage 3, stage 4, and the likelihood of a positive outcome is reduced. So what we want to do with these 5,690 men for 2023 is to add to that, so that when we discover you, we can catch you in the very early stages, so that we can link you to care that is not as aggressive with radiation and chemotherapy as if we catch you in the later stages.
Of course. Dr. Sao, I'm coming to you because I wanted you to share, if you can share with us some of the signs and symptoms that someone has prostate cancer.
First, thank you for having me. The minister's depth of knowledge is so vast that I think you could stop the program now. You said everything. You said everything. But congratulations, Minister, for that initiative you have taken through your ministry. It is so well deserved for our men in the country. And to get to your question straight away, the one misconception men have, well, the majority of men that I meet anyway, is that you don't need to go to your doctor until you have a problem, which is a misconception where prostate cancer is concerned. Because in the early curable stages, prostate cancer produces no symptoms. So here you are, a perfectly normal man, you're trying to convince to go get screened by his doctor. That's a hard job. But that's the only time, or perhaps the only time, we can catch it in its infancy and cure this disease. This disease is curable. And if there's any man who has left this disease to ravage his body, he's a slacker. That's what I said. Because opportunities are available in the public service and in the private service for proper screening, pick up this cancer early, and all modalities of therapy surgical, non-invasive, medical are available right here on these shores. So
Yeah.
for a man to say, well, I didn't know or I didn't have trouble until late, that's slackness. As the minister rightly said, men need to be reminded that we are responsible for our health, not the doctors or the minister of health. Ourselves are responsible for ourselves.
Yeah.
So in the early stages, Kimberly, there are no symptoms. When the cancer starts to develop around the prostate, it impacts in the urinary passageway, the urethra, and you get a set of symptoms related to flow because it's like a hose you're taking your hand, which is the prostate, and squeezing the hose as it gets bigger and bigger. So your flow is going to be interrupted in various forms and fashion. It also grows upwards into the bladder, the immediate neighbor of the prostate, and of course you get bladder symptoms. And the bladder can only react in one way: contract, contract, contract. So make you want to go very often to pee in the day and the nighttime, or some urine may stagnate in the bladder and lead to urination. So the symptoms later on in the disease are related to obstruction of the urethra, the passageway, or in irritation of the bladder upstream.
Yeah. Now, Minister mentioned, men over the age of 40 should get their prostate checked. But how often should this be done? Is this a yearly thing? Is this a 6-month thing? How often?
International recommendation is that you should do it every year at age 40. And once you hit 60, you should do it twice a year because it's an aging disease. The older you get, the increased risk you have of getting this disease. So that's
Yeah.
why they recommend twice a year at the age of 60 plus.
And Dr.
But
Sao,
doc,
if you have been, Minister, you wanted to add something?
yeah, let me just jump in here, Kimberly, and take over
Sure.
your job a little bit. Let me ask Dr. Sao, because men will be interested in this. If you have a family history of prostate cancer, should you be screening more often?
That's a very good question. If your family history is very strong, in other words, your father's had it, your grandfather's had it, and your paternal uncle had it, there's an argument for doing it every 6 months. And that is the
Ah,
exception to the annual screening at age 40. So your genetic risks are much higher than the average man without such a risk.
so your grandfather, your father, and your paternal uncle, not necessarily your maternal uncle.
Comes mainly from the man's side of the genetic dispositions.
Yeah.
Ah, lovely. Thank you,
Yeah.
Yeah.
Kimberly.
Minister, don't get too good at this, huh?
I know. You take over my job just now.
But I wanted to ask Dr. Sao, I mean, how can we prevent this from happening? I know we just mentioned that at times it may be hereditary, so you might not be able to prevent it, but are there other things you can do to prevent prostate cancer?
Thus far in medical science, we can't change your genotype, your
Yeah.
gene makeup. So if you have a risk, genetic risk, there's nothing you can do about that. There are a lot of theories, research that are taking place on how can you prevent the prostate from getting bigger, and perhaps modifying the aggressiveness of the cancer. And this is where diet and a healthy lifestyle comes in. A lot of work has been done into exercise, no smoking, moderate alcohol drinking, especially red wine. Most importantly, this lycopene from cooked tomatoes has to be cooked tomatoes in any form, and the Chinese secret tofu seem to have some
Tofu,
protective benefit on the
interesting.
prostate. But you can't start eating tofu and eating cooked tomatoes when you're 45. It has to be in your lifestyle from young. If you're going to make any change or any influence on the disease, whether it's enlargement or cancerous enlargement. So the truth is, we really have little control, but that little we have, we can make a difference, perhaps by a healthy lifestyle, as the minister has always been pushing.
Yeah. And doctor, are there like any sort of exercises you can do to prevent as well?
The truth be told, not really for the prostate, but generally exercise is a healthy form of activity for all men, all women.
Yes.
But there's no pelvic exercise, and you would read a lot about masturbation and so all that is really crap. There's no pelvic exercise that can really influence the prostate in terms of whether it goes cancerous or non-cancerous.
Yeah. And Dr. Sao, in terms of the type of screenings, I know sometimes the screening might be invasive. Is that the only screening that there is for prostate cancer, or are there different types that you can do?
The screening should be dual. It should be the word invasive is a strong word for the screening. It's just a digital exam in the rectum that may be invasive, that you're invading the privacy of an individual. But it's
Yes.
really in a well lubricated finger is really not a problem. It's very straightforward. But it must be done in conjunction with a PSA test, the prostatic specific antigen test, which is a blood test. And the two results put together will lead to some sort of red flag that will take you to further investigation. But those are the
Yeah.
basic screening that is internationally recognized.
Of course. And Minister, I'm coming back to you. The screenings, the different type of screenings that Dr. Sao mentioned, are these available at the hospital or at the regional health authorities?
So they are available at our clinics across all 5 RHAs, and I encourage men to take advantage of it. Women, I'm going to say something here now. Women are accustomed to being prodded and having their person examined in a very intimate way. Men, not so much. They have this, it's not a phobia, but they have this machismo that they don't want to be digitally examined. I want to urge men, especially those over 40, that it is in your best interest to know the status of your prostate as early as possible, because we don't want to have to treat you for prostate cancer when it's too late, when the quality of your life is severely affected, and when the shortness of your life is one that you are going to face. So like Dr. Sao was saying, men need to step up to the plate now to get screened so that they could understand their status, know their status, and be very, very proactive.
Yeah. Dr. Sao, I'm coming back to you. Are there certain types of exercises or, for let's say, strenuous exercises that can make men predisposed to, hurting their prostate or anything like that?
You can't even touch the prostate where it's located. The Lord has tucked away our prostate in a very secretive place. In fact, removing the prostate by an open operation is very difficult because of its location anatomically. So there's nothing that you can do in exercise. The only thing that sometimes may influence the prostate is long distance cycle riders if they don't use the approved cycle seats. The approved cycle seat has a big hole in the middle. But if you have a hard seat, by that seat keep pushing into your perineum, your pelvic area, into the prostate, can predispose to some prostatic discomfort and probably prostatitis. But in terms of turning it into cancer, we don't have any evidence for that at all.
Yeah.
So long distance cyclists really should be encouraged to buy the new seats with a big hole in the middle. So there's no impact on the prostate and the perineum or pelvic area there.
Yeah, and I wanted you to get there, doctor, as it relates to cyclists, because I know some men would have had that concern. Now, earlier you would have mentioned one of the signs or symptoms would have been that blockage when trying to pass urine. When you see a symptom like that, should you automatically assume it's related to your prostate, or can there be other health challenges as well related to a blockage?
There can be other reasons for that, and the quick message is get to your doctor ASAP and let him determine whether it's your prostate or your urethra or your bladder. Those are the 3 organs in that area. And while I'm talking, the Minister of Health will, of course, will know this better than I do. The economic cost to treat a man with advanced prostate cancer by radiotherapy and those medication is so much more expensive than if you catch him early and treat him early in the hospital service.
Yes.
So the cost of the health bill is so much vastly different to treat an advanced case than to treat a local case. And if you catch people locally, while the cancer is still confined to the prostate, we're looking at the economics of it as well, the savings to the Ministry of Health.
Right. And Minister, before you go, I want you to touch on that quickly in terms of the cost, and just tell us where we can go this weekend, or where men can go this weekend so that they can test. Minister, I'm only giving you 30 seconds, so make it quick.
Okay, so put back up the flyer. It's there this weekend, July 8th and 9th, Eastern Regional Health Authority, the Health Center, 9 to 2, Grandstand, 9 to 2, Colposcopy Center, Mount Hope, 8 to 2, Point Fortin Hospital, 9 to 3, San Fernando Teaching Hospital, 9 to 3, Tobago RHA, 9 to 3. Men over 40, come out and get screened. It's all about him.
Nice. And that's where we'll end it, Minister. Thank you so much for joining us, Minister and Dr. Sao. Well, Dr. Sao, and I hope that all the men over 40 do heed your message, Minister, and attend one of the regional health authorities this weekend. So thank you so much for joining us, gentlemen.
Thank you for having us.
Thank you.
And that was the Minister of Health, Minister Terence Singh, and a consultant urologist, Dr. Lal Sao, just sharing the importance for men over 40 to get their prostates checked. And remember, there is going to be a health drive on this weekend. You're on the Now Morning Show. We're going to take a break and be right back. Stay with us.